Welcome everyone to Herald Christian Health Center's workshop on autism and ADHD. We're thankful to have Dr. Garrick Tong as our speaker. Dr. Tong is in San Diego, so he's joining us via Zoom today. Dr. Tong is a child, adolescent, and adult psychiatrist with over 18 years of experience. He received his medical degree at Albany Medical College. He is an assistant medical director of child and adolescent psychiatry at Family Health Centers of San Diego. He is voluntary assistant clinical professor at the University of San Diego, where he teaches trainees such as fellows, residents, and medical students. He is also a psychiatrist at Herald Christian Health Center. Our workshop today, the first part, we will go over autism spectrum disorder, followed by a short 10-minute Q&A session. For the second part, we'll go over attention deficit hyperactivity disorder, followed by a short 10-minute Q&A session. At the end, we'll go over resources for parents and caregivers. Let's welcome Dr. Tong.
Hi, good morning, everyone. Thank you for having me. We're going to start out by talking about autism. Okay. So first of all, autism is a very broad diagnosis. There is a spectrum, meaning that it can vary greatly. Interestingly enough, over the past years, there is a significant increase in the rate and diagnosis of this condition. At present, according to the Centers of Disease and Control, approximately 1 in 36 children in the US have been identified and diagnosed with autism spectrum. It can occur in all different racial and ethnic, as well as socioeconomic groups. It does occur quite a bit more frequently in boys as compared with girls. Autism also can have other mental health conditions at the same time, including diagnosis of ADHD, intellectual disability, learning disabilities, anxiety, and depression. One of the interesting things that is not on this slide is that the rate of autism seems to be more prevalent in families of science-based and engineering background. That is an interesting observation, thought to be because of various genetic prevalence in that population subtype. Next slide. So it is a spectrum, as mentioned, and it is separated by different categories. The most severe type is called level 3, and this is often seen in cases where the person is nonverbal and is entirely dependent on their caretakers to take care of them, including but not limited to things such as cooking, feeding, bathing. On the opposite end is the level 1, where we call high functioning autism. In the past, there have been other names such as Asperger's disorder, or pervasive developmental disorder. That is also considered a level 1 or high functioning autism. In these people, the symptoms of autism can be much more subtle and may be difficult or less noticeable. They may have minor impairments such as in communication and socialization. They may or may not need any support as far as with day-to-day activities of daily living or educational support. And then finally, in between is the level 2 autism, where it is in between the level 1 and level 2 categories. Next slide, please. We don't exactly know what the cause of autism is. However, genetics, as well as the environment, is very likely to play a role. Some risk factors include being born early, advanced parental age, both paternally and maternally, exposures to various types of chemicals and medications may increase risk. And then finally, if there's one child with autism, there is an increased chance due to genetics that the siblings may also be affected with autism. Next slide, please. So oftentimes, a question that many ask is whether or not vaccines cause autism. And I would like to tell you here emphatically that absolutely vaccines do not lead to autism. Okay. I'm going to repeat that again because this is very important for there not to be any misconception that vaccines do not lead to autism. And the reason is because this has been looked into in many, many studies, totaling over 1 million children over many, many years. And there has not been any link associated with vaccines, such as the measles, mumps, rubella, or thimerosal, which is a preservative, or mercury. Okay. So very important that your children and the children receive their vaccines. Next slide, please. So when do these symptoms start to first appear? It can appear as early as age 3, depending on severity, or even before that. Okay. Over the lifespan, the symptoms may attenuate, or in other words, they improve over time, depending on the person. Autism does improve over time as the person gradually learns new skills. And together with therapy, they can acquire abilities to communicate, whether it be verbally or non-verbally. So it can get better. Next slide, please. So some of the symptoms, and this is just an example, it's not complete. It may include failure to have speech develop at the milestones. It says 9 months here, but generally speaking, speech, first words may not develop up until 12 months, 1.5 years or so, there is, and that doesn't necessarily mean that it is autism. It may just be delayed speech. Okay. Sometimes when these babies or toddlers that do have or exhibit signs of autism, if you call their name, they may not answer, or they may not look at you. They may grab the parent's hand and then point with the hand. So they grab the hand typically, and then they point to whatever they want. Okay. Engaging in imaginary play. So for instance, pretend play, right? Pretend that I'm a policeman and then you're a robber, or I'm a teacher, you're a student. This can be difficult for those with autism. If you do have any concerns about your child missing these milestones, the first step is to speak with your pediatrician, and they will be able to assess and refer to the appropriate professionals. Next slide, please. Okay. So what happens during the assessment? Physicians such as myself, or even other pediatricians, pediatric neurologists, developmental pediatricians, psychologists, they can establish a diagnosis. It can occur before the age of 18 months or younger, but sometimes it does take some time if the symptoms are not as severe. And in some instances, if the symptoms are very mild, such as those in level 1 autism, it may be diagnosed later on in life, such as adulthood. There are developmental screenings at different intervals of age for infants and toddlers. The last bullet point I would like to stress is that getting that diagnosis early on is extremely important, because the earlier you address and identify the issue, the earlier the child is able to receive services. And that is going to lead them to have a more positive outcome the earlier the intervention there is. Next slide, please. So what are the goals? The goals of treating autism is so that we can maximize their ability to function independently and to improve their quality of life. Sometimes achieving total independence is not possible, unfortunately. And in those instances, there may be other interventions such as group homes and so on and so forth. Again, early intervention is key. Teaching the children what is socially appropriate when they play with other children. So for instance, looking at others while they speak, maintaining the eye contact, what is an appropriate way to communicate. And then for those that have what we call self-injurious behavior, where they may engage in aggression and hitting themselves or others, this is also a treatment goal to reduce that type of behavior. Advancing their learning through academics and schooling is also something that the treatment team can help with. Next slide, please. These are some of the things that are basic measures that should be taken if not already done. So the first thing is to secure the home, meaning that if you have a child with autism that tends to elope from the home, putting in certain locks on the doors, on the insides of the doors, so that they cannot reach the lock, or things such as doorbells, so that if a door is open, you can hear it. Okay. Sometimes using a location device. So things such as Apple iWatches or smartwatches, AirTags that you can place onto their clothing, shoes, or backpacks. That can be helpful in case the child runs away. Having some sort of identification bracelet with the child's name, telephone numbers, and contact information in case they are lost. One of the highest risks of mortality, meaning the leading rates of death in this population, is drowning. Okay. And so therefore it is highly recommended that if a child with autism does not know how to swim, that they learn how to do so. Finally, making sure that the neighbors around the residence, as well as local law enforcement, there are certain programs depending on where you live that designate people who have special needs and may not be able to communicate. They may take their fingerprints or photographs so that if they are found by law enforcement, they can be rapidly identified. So I do encourage you to contact your local police department and law enforcement to inquire about those programs. The program names are different depending on where you live. Next slide, please. So treatment. There's different categories of treatment. The first is approach of utilizing behavioral and communication interventions. The type of behavioral intervention that is the most effective and has the most data is called applied behavioral analysis, or ABA therapy. Typically, the ABA therapy is offered through places such as regional center, or more commonly through insurance. Communication devices, or AAC devices, they sometimes look like an iPad with pictures and simple words. And for people that are nonverbal, they may utilize these devices to convey what they would like. American Sign Language, or ASL, for nonverbal autistic people, this can be one method to overcome the communication barriers. Physical therapy and occupational therapy are helpful with any fine motor skill deficits. Social skills training. This is for folks who have difficulty interacting or establishing friendships and maintaining the social contact. Speech therapy is also important, obviously, to promote verbal communication. This can be offered through the schools or through the health plans. For people that have autism that are nonverbal and have difficulty expressing if they feel pain, maintaining a good dental hygiene is very important. They may require having to go to special dentists who have the training and may need to sedate these children because the experience is oftentimes traumatizing for those with autism. Similarly, if there are other areas of infection or pain, such as an earache or a urinary tract infection, these may be triggers leading to aggression, and there may be underlying cause. And so looking for these infections is important as well. The school also has a large role utilizing the Individualized Education Plan, or IEP. And then finally, child psychiatrists are specially trained to be able to help manage these symptoms through the use of medication if needed. Next slide. There is a large team which, as mentioned, can include the child psychiatrist, alternatively, specially trained pediatricians called developmental pediatricians, or pediatric neurologists can also assist with medical interventions. A psychologist can also be helpful with respect to the therapeutic interventions. Speech therapists, occupational therapists, and social workers, as well as others, form a part of the team. All right, so attention deficit hyperactivity disorder. This is one of the most common neurodevelopmental disorders in children. There are different symptoms, of which includes impulsive behaviors or difficulty with focus and concentration, or being very, very hyper. Next slide. Over time, according to the US Centers for Disease and Control, there has been an increase in the rate of ADHD. There are different subtypes of the ADHD. The hyperactive type also is heavily skewed in the ratio, about 4-to-1 male to female ratio. There is another subtype of ADHD called an attentive subtype, which also skews 2-to-1 male to female. There are comorbid conditions such as oppositional defiant disorder, learning disorders, Tourette's, anxiety or mood disorders that can often come together with ADHD. Next slide. So it is generally diagnosed in childhood. Okay. There are circumstances when it is more mild, where it is not recognized into adulthood, but generally speaking, that is more uncommon. As with autism, identifying and treating the ADHD as early as possible is important. The reason for this is because without treatment, it may lead to struggles with school, stress on family, behavioral issues, relationship issues, difficulties with utilizing recreational substances, delinquency, difficulties at work, and various injuries, in addition to a low self-esteem. So treating early is important. Next slide. We don't know exactly what causes ADHD. However, the current research indicates that genetics does play an important role. There are other possible causes or triggers that may exacerbate ADHD symptoms, including brain injuries, exposures to certain chemicals, such as during the birth, if the mother was exposed to lead, alcohol, or substances during the pregnancy, that can lead to increased risk. Premature birth and low birth weight. Preemies are often at risk. Certain food additives, such as the artificial colorants. Recently, there is more data focusing on food dyes, such as Red 40, that is associated with behavioral implications. Next slide. So, common question that parents may ask: is ADHD caused by eating too much sugar? So the answer is that not really, okay? Because while some children or many children may be very, very hyper or active after eating things such as candies and sugars, generally speaking, once that food is out of the system, things return back to normal. However, with ADHD, it is 100% of the time, regardless of candies and sugars. It may get worse by eating high sugar foods, but it doesn't necessarily affect the underlying condition. Next slide. So what are some of the signs and the symptoms? Right? Having difficulty with focusing and concentrating, doing homework, listening to the teachers, disobeying the rules, having to repeat instructions over and over and over. Right? It has to occur in multiple settings. So it has to occur in home and in school. If it only occurs during home, or it only occurs during school, but not the other, then there may be something else going on. The symptoms have to occur before the age of 12. So in other words, if things are completely fine up until adulthood and the symptoms begin in adulthood, then that's not likely to be ADHD. Next slide. Here are more examples of some of the symptoms, which include daydreaming, forgetting things a lot, losing things, squirming or fidgeting or just can't sit still, talking too much and interrupting, making careless errors or mistakes, or taking impulsive risks, not being able to take turns or very impatient waiting in line, having trouble getting along with others, always wanting to do things their way, or being very, very, very bored all the time. Next slide. As mentioned earlier, there's different types of ADHD. The first is what we call the inattentive type. So there may not be the hyperactivity or the fidgeting, but focusing and retaining information and concentration is more difficult. This type of ADHD can be more easily missed, especially if the person is a girl. They're often thought as, oh, she's just a quiet person that doesn't really cause any trouble. The other type is the hyperactive type. This is the more impulsive. They may not have issues with focusing and concentrating, but they're constantly on the go. Go, 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 do this, do that, moving here, moving there. And then the most common type is a combination of both the inattention and the hyperactivity. Next slide. So if you suspect that you or your child has some of the symptoms of ADHD, you can take them to a pediatrician or a psychiatrist for adults, or a child psychiatrist for children. Or a psychologist can also help with diagnosis. The diagnosis can involve various things, such as different forms that the teachers and the parents will have to fill out. There may also be certain tests involving computers. And then finally, you want to make sure that there's no issues with hearing or with their vision that can mimic some of these symptoms. Next slide. Before I begin, this particular slide, there's one more thing I wanted to mention, is that in some cases, if there is snoring, especially for children, that may be a condition suggestive of sleep apnea, which can also lead to difficulties with focus and concentration. So it is not ADHD, but rather a condition called sleep apnea. So behavioral modification, such as utilizing rules and rewards, appropriate positive and negative reinforcement, taking turns, and then a therapist can help with teaching how to interact appropriately and socially, and sharing, taking turns, etc. Next slide. So medication, the good news is that it is usually very, very effective for treating ADHD. There's different types of medications, of which some are on this list. So I would suggest that you speak to your doctor to see what medications, if any, may be appropriate. Just as an aside, for the past 2 years or so since the pandemic, some of these medications have been in short supply. and resulting in shortages across the country. Next slide. So, as usual, beyond medications, having a healthy diet, exercising regularly, limiting the amount of screen time a child is exposed to. So the American Academy of Pediatrics recommends maximum of 2 hours of screen time a day. Getting the appropriate amount of sleep each night, and that changes depending on the person as well as the age.
So for the last part, we'll go over resources for parents and caregivers. And at Herald Christian Health Center, we actually do offer early childhood developmental screening services for children ages 0 to 5. And if there are any findings from the screening, our team will refer for treatment and also other support resources. And as Dr. Tong has said, it is so important for children to get screened and diagnosed early in order to have early treatment and intervention. For special education and other accommodations and support services, you can actually reach out to your local public school district office to request for an assessment for your child to see if your child may be qualified for individualized education plan, IEP, or a 504 plan for the school to provide accommodations and other support services. For autism spectrum disorder, the regional center can provide diagnosis and assessment of eligibility and help to plan, access, coordinate, and monitor services and supports. For the Family Resource Center, they can provide parent support and resources. Autism Speaks is an organization that has a website that can provide a lot of different information and resources for parents and for those who have autism. The San Gabriel Pomona Parents Place provides free parent support groups, online and in person. They have fun activities for the whole family, free workshops, and parenting resources. Attention deficit hyperactivity disorder, the CHAD, is an organization that provides free workshops, support groups, resources for parents and for those who are diagnosed with ADHD.